Okay.
In interview, two speakers are there, and in presentation, one speaker. No.
Right. So the main difference between two types of listening part C extracts we can get interview and presentation is the number of speakers. In interview, you have two speakers, one person interviewing the other person. So the interviewer will be just asking some questions and the main discussion will come from the interviewee, the expert who is being interviewed. Whereas in presentation, you just have one speaker. So all of you have already learned strategies of listening part C. We have had two sessions, one for interview, one for presentation, and all the strategies that you learned for interview are also applicable for presentation because basically it is the same types of questions that you are dealing with. The only difference is number of speakers. So can we quickly recall what strategies do you use when you are dealing with listening part C, irrespective of number of speakers? What are the strategies that you keep in mind when you are dealing with any of the listening part C extract? Yes, everyone? Okay, the very first is prediction. Because in listening, you only have a chance to listen to the audio once. You cannot pause, you cannot repeat, and therefore, we try to prepare ourselves better before the audio starts. And that is called prediction. Right? So this is something we do pre-listening, before the listening actually starts. Then when the listening starts, when the speaker actually starts speaking, what do? Is we try and focus on the main idea. Because any listening part C extract would have majority of the questions that expect you to understand the main idea, which means that they expect you to understand major part of the discussion, not one word like you have in listening part A, right? So the main thing you need to pay attention to for almost all questions in listening part C is to look for the overall idea, except for the detailed questions. Then you pay attention to signposting that helps you understand how the speaker is moving from one point to another, or when they are starting a new point, or when they are presenting an opposite idea, when they are talking about a consequence of something. And finally, their stress pattern. Okay, and we have had a detailed discussion on what features of their stress pattern will help you understand their tone. Whether they are excited about something, frustrated about something, angry about something, or disappointed or nervous about something. Right? So these strategies are common for all the tasks that you will be doing in the listening part C. Now, one we are looking at today is a presentation. How do I know that this is a presentation? Is with the help of a context sentence. Look at the context sentence and it says you hear a dermatologist, Dr. So and so. Otherwise, it will say you hear an interview with Dr. So and so. So here, this is just one speaker speaking, dermatologist, and therefore the extract we are going to listen will be a presentation. Sometimes it will be apparently given that you hear a presentation, right? But sometimes you will have a context sentence like this, but because there is no mention of anyone else, there is no mention of word interview, it tells you that this is presentation. After reading the context sentence, as I say, the first thing we do is prediction. So what we do is we look at all the 6 questions very quickly and we try and find out what point will be discussed in each of these questions. If you see, there is a kind of a typical structure that most of interviews and presentations will have. Here it starts with describing the condition known as HS. Now, what is HS? It is already given here, hidradenitis suppurativa. Now, it's okay if you don't know anything about this condition, because here it says when describing the condition. So, in the very first part of the presentation, the speaker will describe what is HS, yes, and from that you can know. So that gives me a hint that first part of their presentation will be what is HS. Second part, what will they discuss in the second part of the extract? Causes. Yes, here it says one cause of HS may be. So this means in this part, they'll be talking about the causes. Third question says, when describing a case of patient called Sophie, Dr. Cooper suggests that. Now, all of you know that when you are learning a disease condition, particularly when you're looking at the clinical context, then your professor would typically give you case presentation. Right? What is case presentation? Is they tell you the story of one particular patient who had the condition that you are learning. So similarly, here you have a case presentation of patient called Sophie. Next question says, those treating patients with HS should be aware that the condition. So here it is about, not about treatment, but those treating patients with HS. That means the physicians or dermatologists who are treating this condition. It says that the condition should be aware that the condition, which means here he is going to give some recommendations, isn't it? For those who are involved in the treatment of HS. Next one again says, when discussing a patient called Emily, so another case presentation, Dr. Cooper suggests that her mother's attitude. So what hint does this give you about the section or the discussion in this particular topic? Her mother's attitude. Emotion, yes, how everyone will react towards this condition. Because see, they are giving a presentation as a dermatologist. So even if you don't know what is HS, you can at least make out that it should be a condition related to skin, because they are a dermatologist, right? So they will be talking about condition related to the skin. So that is the reason here we are likely to hear family or society's reaction. Yes, someone's attitude means their approach of looking at a condition, their viewpoint of looking at a condition. And final question says, when discussing the treatment of HS sufferers, Cooper recommends they should. So here there is some recommendation for patients, the sufferers of HS. Right? So if you read the context sentence and if you quickly read through the question, it will give you a kind of tentative framework of this discussion. So even if you haven't heard it, now you still have a brief idea of what all things will be discussed. It will start with what is HS, causes of HS, yes? Then recommendation, case presentation, then recommendation for treating physicians or dermatologists, then family's reaction, so that is the emotional aspect of it, and finally, some recommendation for patients or sufferers of HS. That is the reason why the 90 seconds time that you get in listening part C is super important. Whether you will do well in the listening C or not depends on how well you are using that 90 seconds time to understand the context, to understand the framework of interview or presentation. Now, let's say if you have already read the questions and still the 90-second time has not ended, then what you can do next is you can start reading answer choices as well. If you are not left with time, fine, directly start listening to the audio. But if you still have time, then read through the answer choices and underline keywords from the answer choices as well. So now let's do it. And as we do it, we'll also be solving the questions of listening parsing. So here it says, when describing the condition known as anxious, Dr. Cooper suggests that it. So this is a sentence completion task. Right? It is not ending with a question. There can be in part B of listening, part C of listening, there can be two types of questions. One direct question that ends with a question mark. Two, not a direct question, it is a sentence completion task. So here it is a sentence completion task and it says, when describing the condition known as anxious, Dr. Cooper suggests that. Now, if I convert it into question, it is, what does Dr. Cooper suggest? This is a direct question. Okay? So if you're finding sentence completion difficult, then you can quickly convert it into a direct question so that you know what to focus on is what he's saying about the condition. Look at the answer choices and you would see that all three answer choices are different. Right? First one is talking about diagnosis, fairly common, so should be more accurately diagnosed. Second one says, would be better understood if presented more uniformly. So this is also more of a diagnosis because why we would need to understand it is to make diagnosis. But third one says, incorrectly treated. So you'll always notice that there are two options which are very similar and one option that stands out. So here option C is standing out, it is different, whereas option A and B both are about diagnosis. Now if we analyze it further, what is the difference between that? Here it says it is fairly common. So should be accurately diagnosed. Fairly common. What does it mean? Fairly, it's not sure, no. Fairly, somewhat, yes. But common. Common means how many cases do we see? Right? Or how many occurrences or incidences we see. So here it says it is fairly common, so should be accurately diagnosed, whereas here it is highlighting a problem in diagnosing. What could be the problem? It says would be better understood if presented more uniformly. If presented more uniformly, which means right now the cases that you are getting are not uniform. They have different features, different case presentations, and because of that, it is difficult to diagnose. And here it says treatment is incorrect. Why? Because of misinformation from patients. So once you have understood these differences, once you have highlighted keywords, then when you are listening to the audio, what you should do is see which part is a major part of that 1 minute discussion. Almost all the questions will have about 50 seconds to 55 seconds of audio. So when you are listening to it, see whether the major part of the audio is talking about treatment. If that is the case, then C could be the possible answer. Of course, you need to listen to it carefully for more specific information. But if it is mainly about inaccurate diagnosis, then it is either A or B. They both talk about accurate diagnosis, right? So now let's listen to this particular question because some of you might be doing it for the first time. So I'm going to repeat this particular question twice, okay? And then we'll be discussing the answers for this. But from next question onwards, we'll be playing each question once only, just like the way you have in the exam. Before we actually start, let's check if everyone can clearly hear the audio. And then we'll start.
Occupational English Test. Listening Test. This test has three parts.
Online students,
In each part, you'll hear a number of different extracts.
Audible, ma'am.
At the start of each extract, you'll hear this sound. You'll have time to read the questions before you hear each extract, and you'll hear each extract once only. Complete your answers as you listen. At the end of the test, you'll have 2 minutes to check your answers. Part A. In this part of the test, you'll hear 2 different extracts. In each extract, a health professional is talking to a patient. For questions 1 to 24, complete the notes with information you hear. Now, look at the notes for extract 1. Extract 1, questions 1 to 12.
Movements that
Cases are
often think they've got acne, commonly abbreviated to.
Okay, so now the actual question will start.
Hello, my name's Jake Cooper. I'm a dermatologist, and I'm going to talk about a skin condition called hidradenitis suppurativa, commonly abbreviated to HS. Let me tell you a bit about this condition. HS is a chronic inflammatory disorder characterized by painful swollen lumps on the skin, which may break open, releasing fluid or pus. It's also called acne inversa, and in fact, sufferers often think they've got acne or pimples. But unlike acne, HS affects apocrine gland-bearing sites, in particular the armpits and the pubic regions. It's not a very well-known disease in the medical community, which is surprising, as it affects about 1% of the population, and early occurrences are commonly misdiagnosed as simple nodules or abscesses. This is unfortunate, as the condition can be very distressing for the patient.
Okay, now I'll be playing the same question for the second time.
Hello, My name's Jake Cooper. I'm a dermatologist, and I'm going to talk about a skin condition called hidradenitis suppurativa, commonly abbreviated to HS. Let me tell you a bit about this condition. HS is a chronic inflammatory disorder characterized by painful swollen lumps on the skin, which may break open, releasing fluid or pus. It's also called acne inversa, and in fact, sufferers often think they've got acne or pimples. But unlike acne, HS affects apocrine gland-bearing sites, in particular the armpits and the pubic regions. It's not a very well-known disease in the medical community, which is surprising, as it affects about 1% of the population, and early occurrences are commonly misdiagnosed as simple nodules or abscesses. This is unfortunate, as the condition can be very distressing for the patient.
Okay. Now let me know everyone through the chat box which one you think could be possibly the right answer. You guys can write in your book. Which one you think would be the right answer for this particular question? Type your answer in the chat box so that I can compare everyone's answers. If you're not able to finalize, you can also type two answers which you're confused about. Okay. So give it a try. It's okay if it is wrong. Just try to make a guess based on whatever you have heard. Okay, so some A and some C's, that is what I have been seeing. Okay, but A seems to be the most common answer. And yes, it is the right answer. A is the right answer. Because if you look at, or if you pay careful attention to what the speaker was saying, first they explained what is HS, right? So the initial part, because the question also says when describing the condition. So initial part is the description of the condition. And then he says, but here it is not a very well-known disease. Not a very well-known disease in the medical community, which is surprising. Right? So here it is given that the medical community is not aware about this condition, as it affects about 1% of population, and early occurrences are commonly misdiagnosed as. So as we discussed earlier, that there are two main points being discussed here. First two options are talking about misdiagnosis, and third one is about the treatment. But if you look at it, nowhere there was discussion about the treatment. Yes? See, the first part is describing what is HS. Then they have talked about misdiagnosis, and there is only very minute mention of treatment indirectly is when the condition can be very distressing for the patient. But this again is not directly or indirectly about the treatment. So I don't know why all of you are confused about option C, because there is no mention of treatment anywhere in this entire extract. Yes, it is mainly about what is HS and how it is being misdiagnosed as nodules or abscesses because of the medical community's unawareness. It is given that it is not a very well-known disease, that is why fairly common, not very common, right? So it is at least 1% of population is affected by it. And that is why the speaker thinks it is unfortunate that the medical community is not aware about it. It is being misdiagnosed as nodules or abscess rather than being diagnosing it as abscess. So fairly common and therefore should be more accurately diagnosed. Right? So ultimately, it all comes down to your prediction. Prediction doesn't mean predicting which answer is right. No, that's not what I mean, right? Because you can't say which answer is right without listening to the audio. But prediction means trying to understand the questions and answers more clearly so that when the audio starts, it is easy for you to decide which is the correct answer. Okay, let's practice this further with one more question. This time I have not highlighted the keywords in the answer choices because I want all of you to give it a try. Read the question first. It says that Dr. Cooper explains that one cause of HS. So what type of question is this? He explains that. That means this is not an attitude or opinion question. Right? Suggest, believe are feelings. So that is opinion or attitude question. The first one was opinion question because Dr. Cooper suggests that. Or Dr. Cooper explains that. That means he is basically explaining the causes of HS. And what we need to find out, one cause. So this is a detailed question because I only need to find out what is one cause of HS. So how do we deal with detailed questions is we keep in mind what the question is asking for, and when the audio starts, we go on to rule out wrong answer choices. Right? Because here we are not supposed to look for overall idea. There will be some mention of all three options, but we are not looking for overall meaning. We are looking for one cause of HS, and it is also given one cause of HS is blocked hair follicles resulting from. So now we only need to find out what is the reason behind the blocked hair follicles. Right? And options are also pretty clear: shaving, deodorants, and smoking. So this question I'm going to play once only. Listen to it carefully because it is pretty straightforward. And now you have already answered one question, so you should be able to answer this question by listening to it once only. Remember, it is a detailed question, which means you will need to find out evidence for wrong options. You'll have to find out why shaving is wrong, why deodorant is wrong, or why smoking is wrong. Right? There'll be mention of all three of them. Okay, listen to it carefully and answer the question.
As the condition can be very distressing for the patient. We don't know exactly what causes HS, though it seems to be linked to blocking of the hair follicles in the affected area. It tends to occur most often in younger females, and it's often found in patients who are overweight. Studies carried out into a possible link between deodorant use and HS have so far been inconclusive, but the condition is more prevalent amongst smokers, and there's some evidence that nicotine may affect the follicles. Patients sometimes worry that they've caused the condition by shaving, or possibly by using depilatory creams, but there's no evidence that either is a contributing factor. Let me tell you about one case I encountered recently.
Let me know through the chat box, everyone. Only 4 of you have answered. What about others? Okay. Okay, so let's analyze through the transcript. What was being discussed here is you had all three mentions: shaving, It is very clearly given here. We don't know exactly what causes HS, though it seems to be likely linked to blocking the hair follicles in the affected area. It tends to occur more commonly in the young female patients. Study carried out into possible link between deodorant use and HS have been inconclusive. Now, if something is inconclusive means it is not the reason, right? So there has been a no conclusion. No conclusion on this, whether both the way, whether deodorant causes this or whether it does not cause it. Inconclusive means we still don't have the right answer to this. That helps us rule out this option, overuse of deodorants. And then they said that patients sometimes worry that they have caused the condition by shaving or possibly by using depilatory creams, but there is no evidence that either is a contributing factor. So why do you think A could be the right answer? It is very clearly given that it is not, there is no evidence that either is a contributing factor. So if we have no evidence, we all know that in medical fraternity, we can't simply go on, yes, and talk about our own opinions. We have to have evidence for everything. And if there is no evidence, that means you can't say that this is the cause. So for deodorant as well as for shaving, we don't have any concrete evidence. We don't have any conclusion made on it so far. And then it is very clearly given here that it is more prevalent amongst smoker, and there is some evidence that smoking can cause. So for deodorant and shaving, we don't have evidence, but for smoking, we have evidence, and therefore, correct answer is the effects of smoking. This is the reason why I keep on saying, if you are preparing for OET, don't just prepare from the practice test and from the YouTube, because YouTube has all the garbage into it. Do not use YouTube, okay? Because all the tests which are there are inauthentic, not the correct material. Whatever is correct cannot be easily available. So whatever you get on the OET's website is correct. But anything that you are getting on YouTube, Facebook may not be the authentic material, and it may misdirect you. So instead of using that, use YouTube for listening to podcasts, because there you will have this kind of language, research language, trials language, clinical studies which have been performed. Right? So instead of searching, when you are going to YouTube, instead of searching OET, search medical podcasts, search medical presentations, so that you will get this kind of content and practice. If you will search OET practice test, you are going to get only the inauthentic ones, and it is complete waste of time for you if you're practicing through that. So please don't do that. Instead, work on your English through listening to the podcast on YouTube. OET is a test of English, so just doing OET practice test will not help. Okay, now we'll be doing 2 questions at a time, because in exam you will be doing 6 questions at a time without any pause. So we are practicing for that now, and I have underlined keywords from the question, and we have already discussed that it is going to be a case presentation of patient called Sophie, and here there is some advice for physicians who are treating the patients. Now let's analyze answer choices for both of these questions. Now, when describing the case of a patient called Sophie, Dr. Cooper suggests that. So this is typically purpose question. Yes, in purpose question, you will see that the writer or the speaker is giving some example. In this case, they are giving example of patient called Sophie. And the question is asking, what are they trying to prove through that example, right? What is he trying to suggest through this example? Now look at the answer choices. First answer choice is about the prognosis, isn't it? It may get progressively worse. Second one is about diagnosing HS, that it may require a full patient history. And third one is about the treatment. So when you are listening to the example that the speaker is giving for his patient Sophie, you have to understand his intention. Okay? Suggest that what is he trying to prove through this example? Is he giving this example to show how the prognosis of HS is? Is he trying to give this example to explain how it should be diagnosed? Or is he giving this example to explain the treatment? Now, the main catch here is, because it is a purpose question, there will be mention of all of these three things. There will be some information on diagnosis, prognosis, treatment. But you have to focus on his opinion, his sentences, not everything that he's saying about Sophie. But after giving that example, what is his opinion about this? Right? And here in this question, it is very clearly given that they should be aware that the condition. So if I convert it into a direct question, what should the doctors be aware of? Yeah, what they should be aware of. Should they be aware of recurrence, triggers, or difficulty in treating? What is trigger? Depression. Recurrence is very common in many years. So if you look at the answer choices like this, if you try to identify the differences between them, then it will be easier for you once the audio starts. If you cannot do this, what would happen is you will be multitasking. When the audio starts, you will not be able to focus on the audio. You will keep reading the answer choices. And because of that, you will not focus on what the speaker is saying. But if you have done this beforehand, when the audio starts, your 100% focus is on the audio and you can listen to what they are saying. Right? And therefore, this trick works very well if used correctly. So now let's do both of these questions together. I hope I'm not going very fast. Let me know if you have any difficulties at this stage. Okay, so 2 questions this time.
But there's no evidence that either is a contributing factor. Let me tell you about one case I encountered recently. This was a 22-year-old woman called Sophie, who came to see me because she had a number of painful boils in her groin. These had been occurring with fluctuating severity for the previous 3 years. When I questioned her further, I learnt that she'd previously undergone incision and drainage of various lesions on multiple occasions at various medical centres. She also told me that she'd taken a course of an unknown oral antibiotic to treat an abscess about 2 months earlier. So I was able to put 2 and 2 together and make a connection with HS. Then we could start to think about the right sort of long-term treatment for her. When treating patients with HS, it's important to be aware of the impact it can have on them. Many studies have confirmed that patients with HS commonly experience depression as a result of their condition. Additionally, HS has a significant psychosocial impact. Patients reported feeling unworthy and unlovable and described their lesions as ugly, smelly, and embarrassing. In some cases, symptoms may spontaneously resolve themselves for long periods of time. But both doctor and patient need to remember that there could be a flare-up years or even decades later, and that currently, treatment is limited to finding a way to manage the condition. HS may present itself in younger.
Okay, so now let me know your answers for both the questions. Okay, so a lot of you have been able to get the right answer for question number 40. 39 seems to be tricky. Okay, so if you see in question number 39, he had explained how this patient had multiple episodes with fluctuating severity, and once the patient had IND and once they were treated with antibiotic, and that is why a lot of you thought multiple treatment approach. Yes, because both the types of treatments she received. But as I told you, when there is a purpose question, you don't focus on the example. You focus on what the writer or speaker is trying to explain through that example. And how can you know that? Is by writer's suggestion of it. See, from this line here in the beginning up to this line, he's just explaining the case. So that is the example that he is using. Now, what is he trying to prove through that example? He said it here. So I was able to put 2 and 2 together and make a connection with HS. Then we could start to think about right sort of long-term treatment. So through this example, what he's trying to say is, by finding out about her history, that she had this kind of abscesses multiple times of various severity, he was able to put 2 and 2 together. This is an idiomatic expression. If I say to put 2 and 2 together means come to a conclusion of something, right? So this to put 2 and 2 together means to make conclusion on something. So how could he make a conclusion on HS? Is based on what she explained, right? And then he said, then we could start to think about the right sort of long-term treatment. So first we need to confirm what it is, and then we can start the right treatment. That is the reason why diagnosis may require a full patient history. Now, if you keep this in the context of previous 2 questions, what was he mainly discussing in the previous 2 questions? In the first question also he said the same, that the diagnosis can be made accurately because it is very common. So there also he was pointing out towards the mistakes in making diagnosis, and that is the reason why he is giving this example in that context, to explain how can we make an accurate diagnosis is by taking a full patient history. Reading part C and listening part C, you need to remember, it is a whole extract, not 6 separate questions. Yes, so you have to put it in the context of what has been already said. And 40, almost everyone has got it correct, so which is right. The recurrence, because he was explaining how patients with HS commonly experience recurrences. Now there was depression mentioned here, and here also we have the word depression, but here it says triggered by an episode of depression. Yes, that's not the case, because here it is given, studies have confirmed that patients with HS commonly experience depression as a result of their condition. So first they have HS and that leads to depression. Whereas what this option means, what is option B saying? Because of depression, so first depression and that causes HS. Okay? So that is why B is wrong here, because depression was mentioned as a result of HS. And then he was mainly explaining how the symptoms may spontaneously resolve for long period of time, but then they need to remember that there could be a flare-up even after years or after decades. And if even the question is clearly asking you, what does Cooper say to those who are treating, what they should be aware of? Right? So here it is clearly given the signposting. But both doctor and patient need to remember that, should be aware that. This is how signposting helps you to locate the right answer. Right? That there could be a flare-up years or even decades after it. Flare-up again is an idiomatic expression. It means exaggeration, okay, or exacerbation of the condition. Okay, final 2 questions. This time make sure all of you are able to get them correct. I have not underlined anything. I'm not going to do any pre-discussion. This time I want all of you to predict the questions, look at the answer choices, look at the differences between them, and then I will start the audio. Underline keywords from the question so that it helps you know what to focus on. Underline keywords from the answer choices so that you can see the differences. Okay, so these are really your keywords. Dr. Cooper suggests that her mother's attitude, and here it says Dr. Cooper recommends that. So there is some recommendation. That is why here it says they should. So this is some advice being given to the patients. Right? Now that advice is about eating healthy food, restricting dairy, and avoiding alcohol. Yes, they are very clearly distinguishable. Here, lack of sympathy, delay in confirming diagnosis, and contributed to severity. What do you mean by this expression? Contributed to severity? This is again a sentence completion task. Her mother's attitude contributed to severity. What does it mean? To contribute to something means to play a role in, isn't it? I have contributed in the voluntary, whatever is going on, the drive that is going on in your community. So to contribute means to play a role or to take part, to give your contribution to something. But here it's in a negative sense. Her mother's attitude contributed to the severity of the symptoms, which means her symptoms worsened because of her mother's attitude. Right? So now I'm playing this. Listen to it carefully and answer both the questions.
And that currently, treatment is limited to finding a way to manage the condition. HS may present itself in younger patients too. In another case, I saw a 14-year-old girl called Emily who came to see me with her mother following a diagnosis of HS by her GP. We needed to confirm the diagnosis and decide on the most appropriate treatment. Her mother expressed concerns about what she referred to as Emily's unappealing hygiene. This was said in front of the girl. Now, we know that HS is notably not due to poor hygiene. While HS is a skin disease, it's happening lower in the dermis than just the surface level. In this case, Emily had a lesion on the mons pubis, which required surgical intervention. Following incision and drainage, her condition improved. But this does illustrate the need to consider not just the patient, but also the attitude of family members. In general, when it comes to treatment, once we make a diagnosis, there are multiple therapies indicated, depending on the severity of the disease and patient presentation. One thing patients often ask me is whether they need to make changes to their diet. One small-scale study followed 12 HS sufferers who cut out beer from their diet, together with other foods containing yeast, such as bread and some types of cake. And this did appear to have an effect on their symptoms. It's also known that overproduction of one group of hormones called androgens may contribute to the symptoms of HS. These hormones are linked to insulin, and foods such as milk and cheese can raise insulin levels. So reducing these types of foods might be helpful. However, a controlled diet, which leads to weight loss, is certainly recommended for patients who are overweight or obese.
Okay, so now let me know your answers for 41 and 42. This time everyone should answer. We have already done 4 questions, so even those who did not participate in the previous questions should now try to answer. Yes. So now let's discuss. 41 is A. because if you look at her sentence, right here it says that now we know that HS is notably not due to poor hygiene. In this particular question, if you had pay attention to the tone of Dr. Cooper, he sounded very disappointed and he was feeling quite strongly about how her mother's attitude was wrong. And therefore, see, I have also highlighted the words that he spoke with a very high pitch. He said, what she said referred to as Emily's unappealing hygiene. This was said in front of the girl. So you had a very high pitched sound here, and that kind of gives you, through the tone, you get to know that Dr. Cooper doesn't find this appropriate, telling it in front of the girl, because it was quite offending, insulting her, right? Or kind of making fun of her in front of the girl. Now we know that HS is not, again, he used a very high pitch here, is notably not due to the poor hygiene. While HS is a skin disease, it happens lower in the dermis, and then he was basically explaining how she got treated because of it, right? But here it says basically that because of her mother's attitude, we can find out that family members themselves also do not have understanding of this condition. When she said it is because of Emily's unappealing hygiene, she thought it is because of her hygiene, whereas the fact is not due to the hygiene, right? So hygiene has no role to play in it. It happens because of the abnormal function of certain glands. So that is why it is not the diagnosis or the worsening, but lack of understanding. Parents or family members, friends, or normally lay people do not have understanding, lack of sympathy, because it was said in front of the girl without any regard towards her own, like showing empathy towards her, or without having any regards for her emotional state at that point of time. She might have been already very frustrated about getting this. And on top of that, when her mother told it is because of her unappealing hygiene in front of her, this might have resulted in a lot of trauma to that girl, the emotional trauma. And that is what he's highlighting by saying that it is not due to this, but mother thought it is due to this. Now here it is also given that Emily had a lesion on the mons pubis which required surgical intervention. Following incision and drainage, her condition improved. But this does illustrate the need to consider not just the patient, but also the attitude of family members. So there is no problem mentioned in terms of diagnosing it. That helps us rule out option B, led to a delay in confirming the correct diagnosis. When this answer might have been correct if the mother had delayed seeing the doctor, if the mother was not willing to see the doctor, if mother was not willing to go for any physical examination or test. Now, none of that is mentioned here. The mother actually took the patient to the doctor. So her attitude did not result in delaying the diagnosis, and she did not had any problem because of her mother. So that also helps us rule out contributed to severity of the symptoms. But through this example, we can find out how people normally have lack of understanding. They think it is because of poor hygiene, which is not the actual cause of HS. And the next one was about the recommendation. So here it is clearly given that one small scale study followed 12 HS sufferers who cut out beer from their diet together with foods containing yeast, bread, cake. And this did appear to have an effect on their symptoms. Right? So this one sentence here, then these hormones are linked to insulin, and foods such as milk and cheese can raise insulin levels. So reducing these types of foods might be helpful. So this is a clear hint towards dairy products. And bread, it is given it should be avoided, cut out. Cut out means to reduce or to reduce the intake of it. Whereas here it is given eat healthy food such as brown bread. So this is wrong because the fermented products like beer, yeast, cakes, they are all fermented products. So they are to be avoided. Whereas here it says they should eat. That is why it is wrong. And here it was just about beer, right? Not all types of alcohol. Here it says avoid all types of alcoholic drinks. So that is the reason why C is wrong, because there is no mention of other drinks. Plus, there is mention of a lot of other food types. If I only focus on alcoholic drink, then it is not including the food types. Whereas there was a clear indication that milk and milk products increase the insulin production, and therefore reducing this type of food should be recommended. So that is why correct answer here is B, restrict their intake of dairy products. Okay. So this is more of a matter of practice, but not just practicing OET practice test, practicing both of them, OET practice test plus listening to podcast and listening to medical podcast and videos on YouTube. And also, I have suggested this earlier as well, but if any one of you is still not doing it, then TEDMed is the best site for such kind of content. TED Talk has general topics. TEDMed has presentations on medical topics. So this is a very good way of practicing for presentations. Of course, you will not have questions, but at least you will get used to listening to this kind of content. And it also has a function of captions. Right? So if you are not able to understand their pronunciation, you can put the captions on and you can see if you have understood the pronunciations clearly. You will be able to get a lot of research related language on TEDMed, and that is what we get in listening part C. So it will be very useful overall. Now let me know if you have any questions.